First.
I think in general the coronavirus has kind of made everybody a little more isolated than they wanted to be over the course of the last 8 months now.
Yeah.
Has it been? A lot of people are outdoorsy. They like to go to shops. They like to go out and visit family. They like to go out and do stuff. Go to the park, take their dog out, go visit family and friends, and that's kind of been we can't do that really.
Yeah, just for the everyday living person who obviously has the interaction with people. It's not easy for them. For myself, I mean, I am very much stuck in the fact that I'm a gamer.
Yeah.
I prefer being up at night. I don't like the day. I find that I get nothing done during the day because either people mind you or just generalistically you get distracted by everyday life. So my life has always been I get nothing done in the day, but I always get everything done at night. That's how my work situation has been for the last 4 or 5 years, where I generally get most of that done at night. And I
Yeah.
got lucky because I was able to work from home and there was no problem with it. I've always maintained if you're doing a job that requires you to work on a computer, you can do it from home. But companies should be helping that person understand what tech they need to have in their house. And I feel like up until now, they haven't done that when people have tried to work from home.
Yeah. Well, I mean, going back to the health aspect of it, you got to think about the mental health of the individuals or everybody in general, because we're social animals by nature.
Yeah.
So isolating yourself, getting yourself into a box, putting yourself into a box, really having to deal with the outside world from the inside, affects people's mental health. I mean, whether they had mental health problems or issues prior to this event, some people are starting to have them or develop them now because people get cabin fever. They if they were depressed before, now they're really depressed,
Yeah.
or if they were.
But even for myself, who has struggled with anxiety and issues of that sort, I mean, it's very hard for me to say it, but I've had probably a better year this year than I did last. Last year was one of my worst years, but this year has been far better for me. And whether that's because I've been able to lock down in a way where I've been able to exclude myself from people, but even at that point, I was still clamoring for that social interaction. I can get my social interaction by online gaming. I can go on the Discord and talk to my mates and play games and stuff. But as for face to face interaction, I do miss it.
Yeah.
Like there was a point in time there where, for the first time in my life, I hadn't seen my parents for 7 months.
Yeah.
Because they were in Ireland when the lockdown was announced back in March, and they have a house in Ireland, and they decided that they would stay there. And because of what's happened, that's now being made more permanent every day that we continue. Like God knows what their mental health is like with this situation. I talk to them. I try to talk to them every day, but sometimes it's hard to do.
Yeah.
And even for them, like they're in the middle of nowhere, they have no social interaction with anyone really, but they have each other.
Yeah. Well, and then there's the other category too is the aged. They were already kind of isolated from their family to begin with, and now was this maybe one or two visits throughout the year. Now there's no visits throughout the year, and so it really affects the older as well in that regard.
Yeah. Well, I mean, you look at the care homes. You got people who were already of ill health being told, "Oh, you can't have any visitors, and you can't have this," and it's just like, well, hold on a minute. Those are the only social interaction things that people are going to be able to get, and you're basically going, nah, not allowed. I mean, it's a hard situation. You want to control the spread and stuff like that, but I feel sorry for anyone that had a parent in a care home.
Yeah.
I really do.
Or anyone that's suffering from any kind of cancer that need to go to Macmillan
Well,
or
many
to
people had their
yeah.
surgeries cancelled because of
Yeah.
the intake of coronavirus cases. I mean, all the credit in the world to the NHS. They have done a very good job. It's just obviously we're now going down the route of all the schools have went back, which was something that had to happen.
Yeah.
We can't just willy nilly decide, oh, the child's education is a no go. I mean, I do have a feeling, I do have opinions on whether or not the university kids should have went back to university. I feel like those could be handled a lot better. I would have tried to do most of the courses remotely with having sporadic visits to the campus if and where it was possible. But they just decided to let everyone back in, and now you've got campus shutdowns.
Yeah.
With kids locked in their apartment blocks or housing, whatever, I can't remember the name of them. And yeah, it's not a good situation that we're in now. Like, Northern Ireland has just announced a full lockdown. They are closing the schools for 2 weeks now. And I look at it and I'm looking at the numbers going up. Like today, it's went up to 19,000 confirmed cases. Yes, the death rate is still low, but my concern is 19,000 people have tested positive. If it continues going up and the people who are vulnerable to it, the number of deaths will go up.
Yeah.
So it's a progressive cycle of, oh my God, what the hell are we going to do?
But if we socially isolate and we're in the age bracket where we are able to handle the coronavirus and get over it, go through that 2-week isolation, get sick, and then get better, as long as those people aren't going out and spreading the thing.
But here's what I don't get. We started with 3 weeks. Isolate for 3 weeks if you show any symptoms. It then went down to 2 weeks. We're now at 10 days. If you show any symptoms or you get a confirmed case, it's 10 days. But the WHO, the World Health Organization, have said that you can be infectious for up to 28 days.
Yeah.
So where is that disconnect from the World Health Organization saying one thing and our government saying another, and the French government saying another, and the USA saying we don't care? But how do we get that disconnect? Who's doing it for political gain? I understand the Conservatives' point of view. They want people to work. They want people to have the jobs there to do so. However, they are putting money above people's well-being, and that's where it goes into the government's handling of this. In my opinion, there's not much the government could have done much better, apart from everything they decided to do they should have done sooner.
Yep.
Everything they have done is the right thing. There is a certain amount of public responsibility.
Yeah. You can't just have the government say, yes, you must do this, and then no one do it.
Yeah.
I mean, it's two-sided coin. I mean, I am happy to wear a mask. I will wear a mask from the minute I walk out that door until I'm back into the house. No issues. Because I whenever I go to the shop, I think to myself, I'm not doing it for me. I'm doing it for you.
Yeah.
So that's my take on it. And it's like, I mean, I've been in countries before years ago where they wore masks just to wear masks to protect themselves or protect other people from catching a cold, for heaven's sakes.
Yeah.
So it's I don't know. I don't think the social distancing and the face masks are a problem. That's something that we should be doing anyway.
There are some people out there that those aren't the rules that I feel like aren't the ones getting followed. The ones that aren't getting followed is when you go on a local lockdown. We're in Stockport right now. We are supposed to be on a local lockdown where we're not allowed to socialize indoors or outdoors. But yet there are still people doing it. There's still people who are breaking the rules of the local lockdown, but then equally they're not being enforced.
Well, they're being confusing as well. I think when we were in Ireland, they came out with the 6-person max rule.
Yes.
They changed it from a 10-person. You could visit people as long as you weren't like in the house. You could be in the garden with a mask on, or outside social distance without a mask on. I mean, it was confusing for a lot of people.
Yeah.
Like, if we have this, let's just have one standard and abide by that standard.
Yeah, but what made it worse was that Scotland made a rule that was kids under the age of 12, I think, didn't count towards the 6.
Which is weird because children can catch COVID as well. I mean,
but England didn't consider that. England just went, nope, 6.
Yeah, but everyone can catch it. It's not just something that happens to the old or to the Generation X's.
But then it comes down to, why did they allow the kids to go back to school?
I don't know.
That was the case.
Well, I mean, like you said earlier, you can't stop people from getting education because you're gonna. The whole idea of getting education is once you graduate or you finish school and you go to university or you go to a trade school, whatever,
Absolutely.
that you become a viable member of society, and you produce, you help the economy out by getting a job, you know, doing a trade or whatever it is that you're going to do.
Yeah.
So you
But
can't stop
equally,
education.
the person you're educating could be the next person to actually discover a cure for something.
Yeah.
So you have to educate. We always have to educate. There was nothing that we could do apart from what they've done. But the fact that the government seems to be ignoring the glaring issue, if you go on a local lockdown in your area, why are schools still open?
Yeah.
This is my problem. If you're in a high risk area, why are schools open at full capacity? Now, this is the kind of what I would be doing. Year 7 and 9 is a very, very critical time to teach a kid how to learn. But year 10 and 11, their life gets completely screwed up if they don't get their GCSEs done. And in my opinion, if your area goes down in a high risk local lockdown, year 7 to 8 should be sent home. They should be told to stay home for 2 weeks.
Yeah.
And then year 9, I would do it in a sense of you try and split all of year 9 through the rest of it on year 10 and 11. But it depends how big your school is, and it depends how many numbers you have. If year 9 is a very, very big year, then I would say yes, send year 9 home as well. But if year 10 and 11 are small, this is where it's not easy. It's not easy to work any of this out. And this is why it's very confusing when I try to give the idea. But that's the way I see it. Year 10 and 11 are more important than the other 3 years. I'd be sending 2 of the years, year 7 and 8, definitely home. Whereas year 9 would be a question mark. I don't know.
Yeah, but we are in a computer age. There has to be some sort of schooling they can do at home to keep up with it.
Yeah,
so I haven't seen a lot of the programs that the students are using for their homeschooling, but I think it should be more, just more than it's a Zoom call. It should actually be.
No, it is. It is. It's always more than a Zoom call.
Okay.
But they have online systems like for maths. They have MyMaths, for example, which we use, which was brilliant, to be honest. They have English ones, they have science ones, and they all do pretty much the same thing. You assign an exercise, they can fill it in online, and they can go from there. So it works in that sense. It's just whether or not they had the schools had the resource to do that with keeping half the school in, because any teacher through this lockdown period who had to do virtual teaching will tell you that this was the hardest teaching part of their job.
Yep.
They had to do more work. They had to be more available than ever before to do their job. Now, teachers don't get enough credit for how they handled the lockdown situation, because they had all of this work being dumped on them, and they basically got no furlough, and they got all of this headache of having to deal with everyone, from the parents to the students, to making sure that they were doing appropriate things on the webcam, to making sure this and that. It's such a hard situation to be in. So from a teaching point of view, to go straight to just doing that, it would be difficult.
Yeah. So what do you think about the Prime Minister's latest guidance about the red, amber, and the green?
Well, once again, it's confusing.
Yeah.
We've went from an R number to low, medium risk on the COVID-19 track and trace app, to this tier system. Now, don't get me wrong, the tier system is a good idea, but equally, it's also a system that Ireland brought in 3 to 4 weeks ago. They brought in a tier system where if you were at a certain tier, your entire area would be locked down. Not just simply told that you're locked down, they would have police locking the area down. You could not move outside that area, and if you're outside your house, you were told to go home, and if you didn't, you were put in prison. Not fined, put in prison.
Yeah. Well, I think another part of the, you can't stop people from coming into the country, which is another issue. I think that should have been implemented way back in March, and that is you want to control.
They said it several times. They said
they
it.
May
They
have
said
said
that
it,
they
but
were
they didn't
going to
do it.
That's the problem. It just seems to be a lot of hot air from the government when it comes to stuff like that.
I mean, the way you isolate a group of people is to close the borders and isolate the people. Yeah. I mean, Wuhan's a perfect example of that.
China's the perfect example.
They closed that thing down as quick as anything. And if you were there and you weren't a resident, you told go home.
Yep. So, what's your opinion on the track and trace app?
Let's cut this part out because I have no idea about it. I have no idea.
Okay, you just say it.
Well,
Right, so you've no idea about the track and trace app.
yeah, I
It's
don't know
fine,
anything
it's
about
fine.
the track and trace.
Well, basically, the track and trace app is an app you can have on your phone, and what it'll do is it sends out pings and alerts and tries to gather other people's pings and alerts, and it'll notify you if they have been in contact with anyone who's been recently diagnosed with
All right, makes
coronavirus.
sense.
But the controversy around it is that teachers in schools,
Mm-hmm.
certain businesses, especially in restaurants and pubs and stuff, and other sectors, are being told not to use it. They're being told to you're not allowed it on your phone.
Well, I mean, if you go to a pub and somebody in the pub came up with coronavirus and you were there, just happened to be that same day, well, wouldn't you want to know about it?
Absolutely. For me personally, I have no problem with the track and trace app, but so many people have a problem with privacy. They have a problem with the fact that they're collecting this information in the first place, and they seem to have a massive issue with
I don't know. What's more important, your health or your privacy?
my health. Hands down.
My health. I care.
I don't
my
care
health.
about my privacy at all. I mean, I'm not doing anything wrong. My personal opinion is, as long as no one tries to steal my bloody identity,
Yeah.
we're all Gucci. Like I'm cool. I'm just don't try and nick my money. Don't try and steal who
I mean,
I
the
am.
government
I'm
knows
fine. You can know everything about me.
The government knows enough about you already, anyway.
Yeah.
Without even worried about a track and trace.
Yeah. I mean, for God's sake,
They know where I live. They know what car I drive. They know they gave me the license.
They know your internet search history.
Yep. Haha.
They really do. And,
Yeah, well, I mean,
if you
yeah.
use a VPN, they still know your internet search history because it still has to route through the friggin' router. So everyone who thinks a VPN protects you, and these VPN companies saying, "Oh, well, we hide what you search," no, it doesn't. The ISP knows what you're going on.
Yeah. Even that they have the new private tabs now in apps.
Yeah,
Like
they never
Google,
work. The private tab is just so the application you're using doesn't store what you
store
searched.
what you searched.
But
Haha.
the ISP will store everything, regardless if you're using a VPN or not.
You know, your internet service provider will definitely know where you've been, how you've been, and how many times you've been there.
Yeah. So
Yeah.
it's just the same thing. So we're all okay with that, but apparently we have a problem with an app.
Silly.
It is. Like, I have the app on my phone. Yeah, I have the app on my phone, and it just literally updates me to the local area risk level. So at the minute it's high, but it will also tell me how many times it pinged devices every week.
Yeah.
So last week it pinged 22 devices. I didn't leave the house at all for a week. So clearly that's picking up.
Yeah.
Probably not you because you haven't got the app.
Yeah.
But I have two neighbors that are pretty close. We have a driveway that's pretty close to the main road, so it's probably pinging off
And the
that.
train station, or the train track right there.
But it only pinged 22. It doesn't tell me anything about those 22 people.
Yeah.
And those 22 people don't have coronavirus. Like if someone tests it, it literally tells you that someone who has come in contact with you nearby is blah blah. But it works better in a restaurant or a pub or a school where you actually get a scan thing that you check into that place.
Yeah.
And if anyone gets diagnosed with coronavirus in and around the same time you were there, it will tell you automatically if they've checked in also.
Yeah. And what's funny is, you know, when you're like my banking app, for some reason when I took a holiday to Blackpool, it knew I was in Blackpool and denied my transaction. So obviously my phone's telling my banking app, my Google where I'm at. So I mean, privacy's
privacy is overrated. What are
It's
you being
overrated.
private about?
Yeah.
I mean, there's certain professions that you have where you have to be private. I mean,
But they're on lockdown anyway. I mean,
Yeah.
you have to have clearances to get into those jobs.
Hmm.
You know, secret or top secret government clearance.
and you
before can
usually
even
get
into
those. You usually get those actual what are they called? Clearances because you're open
Yeah.
and you're not hiding something. If
Yeah.
you're hiding something, you're never going to get those clearances
Yeah.
because they'll find it.
My entire background for 20 plus years was researched, talked to. I mean, they had interviews with my family, my friends. They want to know where I lived by the address, how many people were living there. I mean, all this information about me before I can even get my clearance.
Yeah.
And then I got it. I'm like, oh, okay, good deal.
Yeah. So obviously, coronavirus is increasing. We know that the amount of affected are increasing. What do you think the government should be doing right now?
Well, personal opinion aside, you know, blocking the ports, closing. We're already infected, and if we're gonna apply this herd mentality to it that people love to clam on about, then fine, let us get sick and get over it.
Yeah.
And so we eliminate the threat inside of our own country. Don't let any more foreigners in to infect us, or to spread anywhere else. You know what I mean?
So would you do anything else in terms of how they're doing with the local stuff?
Well, I mean, have a standard and apply it across the country. But if you're gonna use the whole,
so you wouldn't do the local lockdown stuff.
So the tier system, the red, amber, and green, as it applies to your area, and then if you're a red and you're at high risk and you're locked down, do what you're told.
So how would you get the government to police that? Because clearly we both agreed that the problem is more on the public.
Yeah. Well, do we have a police force big enough to do that? I mean, I don't want to get...
I argue we do. The police force just need to get rid of the bureaucracy. That is not me saying that the police are able to do their job perfectly, because they have been defunded and there should be more policing in the country. However, you get rid of the red tape and the amount of report writing that they have to do, they could do a more effective job for all of us.
One thing I don't want to happen is because it instills fear in the public, and that is to get the military involved.
Yeah, no one wants the military involved.
So that is definitely a no-go, as I know there are,
the only time I'd get the military involved is to help the NHS, and that is more about getting people in and out of hospital.
Well, yeah, like maybe to assist facilitating testing or some other non-violent, in-your-face...
non-aggressive. I think violence a bit of a harsh one. If you get the army involved in policing,
have you seen America lately?
We're not talking about America.
Oh, true. But coronavirus is everywhere, so you know. Thanks for watching. If you liked our video, give us a like and smash that subscribe button. For more videos, click to the left. Bye.